The corona crisis had a lot of impact on our lives, on our social lives, on our psyche, on our healthcare system, on our health as well. So what are the main points? I'm going to discuss it in this video. Hi, my name is Dr. Patrick Nuernberger and I work as a physician in Austria. On my social media channels, I try to teach about medicine and medical topics. If you like my channel, if you like my videos, please leave a thumbs up, subscribe to the channel, and leave a comment if you like. So getting into the topic, I spent a lot of thought on that as I just recently wrote a book about it. It is not out yet and it's only going to be available in German, but it will be out there soon. So if it is, I will link it probably in the description for you if you're interested. So there's a lot of topics to cover here. First of all, I would like to start with our psyche. There's a lot of psychological and psychiatric problems developing from the corona crisis. So we have seen that in previous pandemics, there have been psychiatric problems. We have also seen that in a previous disease called SARS, now remember it's not SARS-CoV-2, that's the new one, it's been SARS, a couple of years ago, that about 1/3 of the people that were infected with SARS developed depression or any other psychiatric disease. 1/3, that's a lot, that's insanely a lot. And that is only the percentage of people who had the disease. So why should we not see a similar effect in SARS-CoV-2? A disease being very closely connected to SARS. We do not know that yet, but I'm very interested in seeing how this goes. Another problem that we see now, that we have to face now, is that all those measurements we had, the lockdowns, the social distancing, all of those facts, they accumulate and they cause a lot of psychiatric problems, especially depression. Now, we can even combine the people suffering from the disease, probably developing depression after being infected with SARS-CoV-2, and we can combine them with those people who are affected with the measurements and the surroundings of the crisis, meaning the lockdowns, the social distancing, or being afraid to lose their job or not knowing about the future. So that is a huge problem. Another problem is that we do not really have the resources to cover all those people. Where should those resources come from? I mean, in healthcare, we always work at our limits, I would say. So if there's a lot of new patients, and this is what we will probably see in psychiatry, then there are no resources left for all those new patients because the resources are already used by those who are already in the running system. And we can only cover so many more new patients. And now there's a huge swath of new patients coming. So that is going to be a problem. This problem has even made it to the media some weeks ago, at least talking about children's psychiatric diseases and problems that are not being able to be covered anymore. And we will also probably see this in adults and grown-up patients. That is one problem. This leads me directly to the influences on our healthcare system. So here in my country, in Austria, as well as in many other countries, for weeks, months, even a year now, we did not perform much of the planned surgeries or of planned schedules. So all we did was covering all the emergencies to keep resources open for COVID patients, which was important and also the right thing to do. We do not question that, and I do not question that. But that leads us to the problem that we did not perform our standard work for months. And all those patients they need their treatments, they need their surgeries. So they will have to wait until later and later and later. But in this time, new patients are coming up as well. So there's also a huge pot of patients that will need to be treated right after the crisis, for whenever that will be. Now the crisis is not over yet, but I think we will get back to a normal hospital life anytime soon. That will be doable, I think so. But there's so many patients now, and by far not enough resources, that I am not sure how we should cover that ever. If you have an answer to that, please write it in the comments. I would be very interested to see and to listen. But I, for myself, I cannot find any reasonable way in my mind, and I don't have any ideas how this should be done. This is going to be a huge problem in the future. But as I said, I do not know any answers to that. Another problem, or topic, if you will, are the influences that we see in our social system. So there's a lot of problems as well. First of all, we are now in a new normal. So social distancing is a new normal. You wouldn't touch somebody else's hand, for example. I think that will vanish anytime soon after the crisis is over or well managed. So we will probably get back to our old normal life. Yeah, that is okay. I don't think that will last. But there's some things that will last, and I'm sure about that. There's an economic factor. So some people suffered economically from the crisis. We don't have to argue about that. There's a lot of people who maybe lost their businesses, maybe lost a lot of money. But there's also a lot of people who took their profit from the crisis. As we know, stock markets, crypto markets, they went down right at the crisis. And shortly after, they started to go up again. And right now, 1 year after the crisis started, they're up at insane heights. So there's many people who took huge profits out of that if they put their investments at the right time. So what we will see is that the canyon between the poor and the rich people will get bigger and bigger and bigger. And there's not only going to be poor and rich, there's probably going to be poor, rich, and super rich. And so I think, and I'm a doctor, so I'm not an expert in economics. That is just my opinion, and that's what I read and heard about that issue from people who are experts in the topic. So I also do believe that this is true and that this is something that we'll probably see in the long run here. So we will need, how should I put it? We will need to make sure that people are socially secure and that they stay socially secure. Especially in my country, that is important, and we live in a social system that is pretty good, but other countries should also adapt their systems to those upcoming events and those upcoming problems. I do strongly believe so. Now, we have the vaccinations. That is a good thing. And people still sort of fight the vaccines, and they come up with strange news, strange facts. Most of the time, just absolutely insane fake news. And I don't know why that is. I mean, on the one hand, I do know that it is some psychological trick of the mind to create fake news and to create conspiracy theories if you're afraid of something that you can't control or that you do not know enough of. That's fair, that's okay. On the other hand, there's so many experts telling you the right things, and people still don't believe it. And I think that is a problem. Why do people trust some guys they see on social media more than experts who spend years and years of training and work in those special fields? I don't really know why that is. One big problem here is that if you just shout loud enough and if you write very colorful and bright headlines, then you will get the attention from people. And you also need short messages. So that is a problem, because people who know answers and who are into this stuff, they tend to not be too loud, and they tend to give you very detailed information. So that is way too long and way too much for our fast and digitalized world. So this is why people are probably so keen on fake news and just people shouting nonsense out there. So this is a phenomenon and also a problem that I see. Another thing I want to tackle is people in healthcare systems, and it is a real problem all around all the countries, not just in Austria or Germany, also in the United States, everywhere, that people in healthcare, they're overworked, they're overstressed, so the pandemic also hit them hard, and so they want better conditions at their work, and it doesn't seem that there's a huge possibility of seeing any improvements in the conditions at all. So I do think that this is a huge problem, but I'm also not sure how to deal with that problem or how to improve it. Because right at the beginning of the pandemic, there has been concerts on the streets, coming out from the windows, clapping people, telling them that they are relevant, telling them that they are important, and thank you all over social media. That is nice, yes, but it is not helping at all. So I do not think that this changed anything in the working conditions of those people. As a fact, I know it hasn't. And I'm also very sure that it is not going to change anything in the near future. Why? I don't know. The problem is the people who work in healthcare, they're usually very social people, so they work at, well, let's say, not ideal conditions. And that happens out of healthcare as well, I know. I'm sure about that. But especially in healthcare, that's at least where I see it most and where I'm also working at. So that's where I have my connection. And this is not a good thing. So if there's any possibility to support your healthcare workers, your nurses out there, do it. If there's a petition going on to improve their working conditions, just sign it or do your part if you can. That would be very helpful. So I think there's a lot of people out there in healthcare, especially the nurses, who have a very strong contact to the patients and who are probably the people who suffered the most in the pandemic because they're the ones who really work close to the patients. So if there's a possibility to improve the conditions, please do your part and help them. Yeah, so one last thing before we probably end this session here is that we see a lot of long COVID syndromes. So people who had a COVID-19 infection, they have long-term problems. Long-term meaning weeks, months. Some of them even suffer from them for about a year now, and no one knows if those symptoms are going to disappear anytime soon or at all in their lives. And those problems are significant. So there's this brain fog where people have symptoms like dementia, so they forget things, they're not as cognitive, well, perfect as they were before. That is a problem. Then there's a lot of people who cannot really perform physically the way they did before. So people who were very active in exercises and sports, they cannot even go up, I don't know, 50 stairs without being out of breath. And that is not a good thing, because for those post-infectious syndromes, and those long COVID or post-COVID syndrome, whatever you call it, there's no therapy. So all we can do is basically wait if it gets better or not. And let's hope that it gets better for those people who are affected. And there's a lot of people, also young and fit people, who are affected by that. So this is a problem, and this is why I don't really understand why people say they are not afraid of COVID and they're young and healthy. So what should happen? It is true that if you're young and healthy, you will probably not have severe symptoms. You are very unlikely to end up in an ICU or even die. It can happen, but it's very unlikely. But many of those people suffer from this long-term problems and this post-COVID syndrome. So I do think that this is a problem, because this impacts and decreases your quality of life significantly, in my opinion. So that is one reason more to stay safe and to get your vaccine. Yeah, so I wanted to just say a few words about that. So let us end for today. If you liked my video, please, as always, subscribe to the channel, ring the bell that you don't miss any future videos. Leave a thumbs up and a comment. Comment with anything you want. I would be happy to answer any questions that came up, or just tell me how you liked the video. And until next time, stay healthy.